Professional Ethics for Naturopathy Law. This video is property of Ravzer. Understand ethical principles. Fundamental ethical principles that guide naturopathic practice, including autonomy, beneficence, non-maleficence, and justice. Autonomy. Informed consent. Practitioners must ensure that patients understand the nature of their condition, the proposed treatment, potential benefits, risks, and alternative options. This involves clear communication and the opportunity for patients to ask questions. Patient preferences. Autonomy means respecting patients' personal values and preferences, even if they differ from the practitioner's views. This may include dietary choices, lifestyle modifications, and preferences for types of treatments. Capacity to decide. Practitioners should assess a patient's capacity to make informed decisions. For those who might have diminished capacity due to age, cognitive impairment, etc., additional support or surrogate decision makers may be required. Application in naturopathy. Ensure that all treatment options, including those outside of naturopathy, are discussed. Respect patient choices regarding their treatment plans, even if they opt for alternative or complementary approaches. Beneficence. Positive outcomes. Practitioners should aim to provide treatments that offer a clear benefit to the patient's health and well-being. This involves staying updated with current research and clinical guidelines. Holistic approach. In naturopathy, beneficence also means considering the whole person, physical, emotional, and social aspects, in treatment planning. Preventive care. Promoting health and preventing disease through lifestyle advice, education, and early interventions is a key component of beneficence. Application in naturopathy. Choose interventions that are evidence-based and have shown positive outcomes in similar cases. Incorporate preventative measures and lifestyle recommendations to support long-term health. Non-maleficence. Avoiding harm. Practitioners should carefully consider potential side effects and adverse reactions of treatments. This involves assessing risk versus benefit and avoiding interventions that may cause more harm than good. Monitoring and adjustments. Regularly monitor patients for any adverse effects or complications, and be prepared to modify or discontinue treatments if necessary. Transparency. Be honest about potential risks and limitations of treatments to avoid misleading patients. Application in naturopathy. Use therapies and remedies that have a low risk of adverse effects and are well tolerated by most patients. Continuously evaluate the effectiveness and safety of treatments and make adjustments based on patient feedback and clinical observations. Justice, equitable access. Ensure that all patients have fair access to care, regardless of their socioeconomic status, race, or other factors. Resource allocation. Distribute resources, including time and attention, fairly among patients. This involves avoiding favoritism and ensuring that each patient receives appropriate care. Advocacy. Engage in efforts to advocate for fair access to naturopathic services and promote policies that support equitable healthcare. Application in naturopathy. Provide care that is accessible and affordable to a diverse patient population. Advocate for policies that improve access to naturopathic treatments and support underserved communities. Integrating ethical principles. In practice, integrating these ethical principles requires balancing them against each other and adapting to each patient's unique situation. For example, a practitioner might face a situation where respecting a patient's autonomy conflicts with the principle of beneficence. In such cases, careful consideration, transparent communication, and possibly seeking ethical consultations are necessary to navigate the best course of action. Legal and ethical frameworks. Legal frameworks that govern naturopathic practice, including relevant national and international laws, regulations, and standards. National legal frameworks, U.S. regulations, state licensing boards. In the U.S., naturopathic medicine is regulated at the state level. Each state has its own board of naturopathic medicine that sets the rules for licensing, scope of practice, and continuing education. States like Arizona, Oregon, and Washington have well-established licensing boards, while others have more limited regulation or none at all. Scope of practice. States vary in their scope of practice laws. For example, some states allow naturopathic doctors, NDs, to prescribe pharmaceuticals, while others do not. Understanding your state's specific regulations is critical for legal practice. Education and certification. Accredited programs, such as those recognized by the Council on Naturopathic Medical Education, CNME, are often required for licensure. Additionally, passing the Naturopathic Physician's Licensing Examination, NPLEX, is typically necessary. Canadian regulations, provincial regulation. In Canada, naturopathic practice is regulated provincially. Each province has its own regulatory body, such as the College of Naturopaths of Ontario or the British Columbia Naturopathic Association. Scope of practice. Similar to the U.S., the scope of practice can vary. Naturopaths in some provinces can prescribe certain medications and perform specific procedures, while others have more restricted scopes. Accreditation. Naturopathic schools must be accredited by the Council on Naturopathic Medical Education, CNME, or a similar body. Licensure requirements often include graduation from an accredited program and passing licensing exams. UK and European regulations, professional associations. In the UK, naturopathy is not regulated by statute, but practitioners may be members of associations like the Naturopathic Association or the British Association of Nutritional Therapists and Herbalists, BANT, which sets standards for practice. Scope and training. In the EU, regulations vary by country. Some countries have specific regulatory frameworks, while others rely on professional associations to establish standards. International standards and guidelines. World Health Organization, WHO. Traditional medicine strategy. WHO provides guidelines on integrating traditional and complementary medicine into national health systems. Their focus includes safety, efficacy, quality control, and regulation. Research and standards. WHO also supports research and the development of standards for traditional medicine practices, including naturopathy. International naturopathic organizations. International Naturopathic Association, INA, works to promote global standards and advocate for the integration of naturopathic medicine into healthcare systems. They provide resources and guidance on ethical and professional practice. Ethical guidelines. Patient-centered care. Autonomy and respect. Practitioners must respect patient autonomy and involve patients in decision-making about their treatment. This includes providing all necessary information for informed consent. Cultural competence. Practitioners should be aware of and sensitive to cultural differences, adapting care to meet the needs and preferences of diverse patient populations. Professional integrity, honesty, and transparency. Practitioners should be transparent about their qualifications, the limitations of their treatments, and the evidence supporting their recommendations. Conflict of interest. Avoid situations where personal or financial interests could compromise patient care or professional judgment. Clinical competence, continuing education. Engaging in ongoing education to stay updated with advancements in the field and maintain competence. Evidence-based practice. Utilizing treatments supported by scientific evidence and clinical research. Record-keeping and confidentiality. Accurate records. Maintain detailed and accurate patient records to support clinical decisions and comply with legal requirements. Confidentiality. Ensure patient information is kept confidential and secure, and disclose it only with patient consent or as required by law. Advocacy and integration policy. Advocacy, engagement with policymakers. Actively engage with policymakers to advocate for the recognition and integration of naturopathic medicine into mainstream healthcare systems. Public education. Promote awareness of naturopathic medicine and its benefits through public education campaigns and professional presentations. Regulatory compliance. Monitoring changes. Stay informed about changes in regulations and standards to ensure ongoing compliance. This may involve participating in professional organizations and subscribing to relevant updates. Ethical decision-making. Develop skills in ethical decision-making, including how to apply ethical principles to complex cases and dilemmas in naturopathic practice. Developing skills in ethical decision-making is crucial for handling complex cases in naturopathic practice. Here are some strategies to help you navigate ethical dilemmas effectively. Understand ethical principles. Familiarize yourself with core ethical principles such as autonomy, beneficence, non-maleficence, and justice. These principles guide the decision-making process by emphasizing respect for patient autonomy, doing good, avoiding harm, and ensuring fairness. Reflect on ethical dilemmas. When faced with a dilemma, reflect on the conflicting values or principles at play. Consider how each option impacts the patient's well-being, your professional integrity, and the broader implications for the practice. Consult professional codes of ethics. Review the ethical guidelines provided by professional naturopathic organizations. These codes offer valuable insights and can help ensure that your decisions align with established standards. Engage in critical thinking. Evaluate the potential outcomes of different actions. Think through the short-term and long-term consequences for the patient, yourself, and the practice. Seek supervision and peer support. Discuss challenging cases with colleagues or mentors. They can provide different perspectives and help you consider aspects you might have missed. Document your decision-making process. Keep detailed records of your decision-making process, including the reasoning behind your choices. This documentation can be useful for reflection and accountability. Consider legal and regulatory requirements. Ensure that your decisions comply with legal and regulatory standards governing naturopathic practice. Understanding the legal context can help you avoid potential legal issues. Prioritize patient welfare. Always focus on what is in the best interest of the patient. Make decisions that align with their health goals, values, and preferences. Review and reflect. After making a decision, review the outcomes and reflect on the process. Learning from each experience will enhance your ethical decision-making skills over time. Patient rights and confidentiality. Understand the importance of patient rights, including informed consent and confidentiality, and how to uphold these rights in practice. Patient rights and confidentiality are fundamental principles in healthcare that ensure respect, trust, and safety in the patient-provider relationship. Here's a breakdown of these concepts and how they can be upheld in practice. Patient rights. Informed consent. Elements of informed consent. Disclosure. Provide information about the diagnosis, nature of the proposed treatment or procedure, expected benefits, potential risks, and alternatives, including the option of no treatment. Competence. Ensure the patient is legally and mentally capable of giving consent. If not, consent must be obtained from a legally authorized representative. Understanding. Confirm that the patient understands the information provided. This might involve asking the patient to explain the information in their own words. Decision-making. Ensure the patient makes the decision voluntarily without any form of duress or undue influence. Special considerations. Language barriers. Provide translation services or materials in the patient's preferred language if needed. Illness. Impact. Consider how a patient's mental state or cognitive function might impact their ability to provide informed consent. Emergencies. In emergency situations where obtaining informed consent is not feasible, provide necessary care and obtain consent as soon as the patient is able. Right to privacy and confidentiality. Legal and ethical framework. O. Health Insurance Portability and Accountability Act, HIPAA. In the U.S., HIPAA sets standards for protecting sensitive patient information. Other countries have similar regulations. O. Ethical Codes. Professional ethical codes often emphasize the importance of patient confidentiality. Practical steps for confidentiality. O. Physical security. Use locked cabinets for paper records and secure electronic systems with strong passwords and encryption. O. Access control. Limit access to patient information to only those who need it for treatment or administrative purposes. O. Data disposal. Ensure proper disposal of documents containing patient information, using shredders or secure deletion methods for electronic data. Handling confidential information. O. Patient requests. Honor patient requests to view or amend their medical records. Provide a clear process for handling such requests. O. Communication. Use secure methods for communicating sensitive information, such as encrypted emails or secure messaging systems. Implementing these principles in practice, training, and policies. Develop comprehensive training programs. O. Include real-life scenarios and case studies to help staff understand the application of privacy and consent principles. O. Provide ongoing training and updates to keep up with legal and technological changes. Create and enforce policies. O. Privacy policies. Draft and disseminate clear privacy policies outlining how patient information is handled and protected. O. Incident reporting. Implement a procedure for reporting and addressing breaches or violations of privacy. Communication. Building trust. O. Patient-centered approach. Engage patients in their care and decision-making processes. Respect their preferences and involve them in discussions about their treatment. O. Feedback mechanisms. Provide patients with a way to give feedback about their care and any concerns regarding privacy or consent. Transparency. O. Information sheets. Provide written materials explaining patient rights and how their information will be used and protected. O. Patient rights posters. Display posters in waiting areas and examination rooms detailing patient rights and confidentiality practices. Monitoring and compliance. Regular audits and reviews. O. Audit trails. Use audit trails to monitor access to patient records and identify any unauthorized access. O. Compliance checks. Regularly review policies and procedures to ensure they comply with current regulations and standards. Addressing breaches. O. Response plan. Develop a breach response plan outlining steps to take if patient information is compromised. O. Notification. Notify affected patients promptly if their information has been breached and provide guidance on how they can protect themselves. By deeply understanding and applying these principles, healthcare providers can create a respectful and secure environment for patients, ensuring their rights are upheld and their confidentiality is maintained. Professional conduct. Explore expectations for professional conduct and behavior, including maintaining professional boundaries, avoiding conflicts of interest, and ensuring transparency in all interactions with patients and colleagues. Professional conduct is crucial in ensuring trust, integrity, and effective practice in any healthcare field, including naturopathy. Here's an overview of key expectations for professional conduct. 1. Maintaining professional boundaries. Respect and dignity. Treat patients with respect, maintaining their dignity at all times. This includes respecting their personal space and confidentiality. Clear role. Definition. Clearly define your role and avoid taking on responsibilities that fall outside your scope of practice. Physical boundaries. Ensure that physical interactions with patients are appropriate and necessary for the treatment. Always obtain explicit consent before any physical contact. Emotional boundaries. Be mindful of the emotional impact of your interactions. Maintain a professional demeanor and avoid becoming overly involved in the patient's personal issues. Avoid dual relationships. Avoid situations where personal relationships could affect professional judgment. This includes avoiding becoming friends with patients or engaging in social interactions that could blur boundaries. 2. Avoiding conflicts of interest. Disclosure. Disclose any potential conflicts of interest to patients and colleagues. This includes financial interests in products or services you recommend. Impartiality. Make recommendations based solely on the patient's best interests, not influenced by external factors like financial incentives or personal gain. Professional integrity. Refrain from endorsing or promoting products or services unless they are supported by evidence and truly beneficial to the patient. Financial transparency. Avoid situations where financial incentives could influence your recommendations. If you receive any form of remuneration from recommending specific products or services, disclose this to the patient. Referral practices. When referring patients to other practitioners, ensure the referral is based on the patient's needs rather than any personal or financial interests. 3. Ensuring transparency. Informed consent. Provide clear and comprehensive information about treatment options, including potential risks and benefits. Ensure patients understand and consent to their treatment plan. Documentation. Keep accurate and thorough records of patient interactions, treatments, and progress. This ensures accountability and provides a basis for ongoing care. Honesty. Communicate honestly with patients and colleagues. If you do not know the answer to a question, acknowledge it and seek the necessary information or expertise. Patient education. Educate patients about their conditions and treatment options. Use clear, non-technical language and provide written materials when possible. Conflict resolution. Address any conflicts or misunderstandings openly and professionally. Seek to resolve issues in a manner that respects the patient's perspective and maintains trust. 4. Additional considerations. Confidentiality. Maintain patient confidentiality in all interactions, both within and outside the practice. This includes protecting patient information and only sharing it with authorized individuals. Professional development. Engage in continuous professional development to stay current with best practices and emerging research. This demonstrates a commitment to providing high-quality care. Ethical decision-making. Apply ethical principles to decision-making processes, particularly in complex or challenging cases. Seek guidance from ethical guidelines or professional bodies when needed. 5. Professional relationships. Colleague collaboration. Collaborate respectfully with other healthcare professionals. Share information and insights while respecting each professional's expertise and role. Supervision and mentorship. Seek supervision or mentorship if needed, and offer guidance to less experienced practitioners. This supports ongoing professional growth and ensures adherence to ethical standards. 6. Self-care and professional balance. Self-awareness. Recognize your own limitations and seek help or refer patients when necessary. Self-care is crucial to maintaining professional effectiveness and preventing burnout. Work-life balance. Maintain a healthy balance between professional and personal life to ensure sustained well-being and effective practice. Regulatory compliance. Learn how to comply with regulatory requirements specific to Philippine naturopathy and understand the implications of non-compliance. To comply with regulatory requirements for naturopathy in the Philippines, you'll need to navigate both national and local regulations. Here's an overview to get you started. Understanding the Regulatory Framework Department of Health, DOH. Naturopathy recognition. Currently, naturopathy isn't formally recognized or regulated under specific DOH guidelines. However, you should still follow general health regulations and standards that apply to alternative and complementary practices. Health standards. Adhere to general health and safety standards set by the DOH, which might include hygiene, infection control, and patient safety protocols. Professional Regulation Commission, PRC. Licensing requirements. Although PRC primarily regulates licensed professions like medicine, nursing, and pharmacy, it's important to verify if there are any emerging regulations or proposals related to naturopathy, licensing, and certification. Business registration. Register your practice as a business with the Department of Trade and Industry, DTI, or the Securities and Exchange Commission, SEC, if applicable. Local permits. Obtain necessary permits from your local city or municipal government. This might include a business permit, health permit, and potentially a special permit for operating a health practice. Additional certifications. Consider obtaining certifications from recognized naturopathic or alternative medicine organizations if they offer credentials that can enhance your credibility and practice. Practice guidelines and standards. Ethical guidelines. Follow ethical guidelines and professional standards set by any relevant national or international naturopathic organizations. Quality of care. Implement best practices for patient care, including accurate documentation, informed consent, and confidentiality. Training and education. Keep your skills and knowledge up to date through continuous education and professional development opportunities. Insurance and liability. Professional liability insurance. Obtain comprehensive insurance coverage that protects against claims related to professional negligence, malpractice, and other legal issues. Insurance requirements. Ensure that you meet any specific insurance requirements related to your practice, including coverage for treatments and procedures you offer. Implications of non-compliance. Legal consequences. Be aware of the potential legal consequences of non-compliance, including fines, penalties, or legal action against your practice. Reputational damage. Non-compliance can harm your reputation and trust with patients, potentially leading to a loss of business and professional standing. Patient impact. Ensure that your practice meets safety and efficacy standards to avoid compromising patient well-being. Advocacy and representation. Professional associations. Join organizations like the Philippine Naturopathic Association or other relevant groups. They can provide resources, networking opportunities, and updates on regulatory changes. Advocacy efforts. Engage in advocacy efforts to promote the recognition and regulation of naturopathy in the Philippines. Participate in forums, discussions, and policy-making processes related to alternative medicine. Staying informed. Regulatory updates. Regularly review updates from regulatory bodies, professional associations, and industry news to stay informed about changes in regulations and standards. Legal advice. Consider consulting with a legal expert specializing in health law to ensure that your practice remains compliant with all applicable regulations and to address any complex legal issues.